So good afternoon, ladies and gentlemen. My name is Sam Magaziner. I'm the CEO and co-founder of Enviro, where we are evolving a cleaner future using plastic-eating microbes. So before I begin, I want to pose a simple question. Do you know where your plastic waste goes? Now, some of you might be avid recyclers, and some of you might not have given this much thought. But would you be surprised to know that in either case, most of your plastic waste wound up in places like this? This is Juhu Beach in Mumbai, India. Each day, hundreds of pounds of waste wash upon its shores and are removed by workers for the beachgoers. But by the next morning, that waste will have returned. If nothing is done to stem environmental pollution, this will be every shoreline in the world. So how did we get here? To answer that question, we first have to understand a little bit more about plastic. Since 1950, 6.3 billion tons of plastic has been produced, or rather plastic waste. 70% of this waste will end up in the landfill or the environment and our oceans. This is particularly problematic when you realize that plastic has a lifetime of up to 1,000 years. One of the most common types of plastic is PET, or polyethylene terephthalate, the type 1 plastic, commonly found in items such as water bottles. So let's dive a little deeper into the life cycle of plastic. Most plastics begin as fossil fuels. These fossil fuels are converted into chemical precursors. The chemical precursors are then sold to PET manufacturers who make plastic for you, the consumer. Once used, the consumer has a choice. They can either choose to discard the plastic in conventional waste streams, which will end up in the landfill or environment, or they can choose to recycle. If they recycle, the plastic is brought to a sorting center and sold as a commodity to a plastic processor. The plastic processor takes your used plastic and converts it to lower quality, regrind plastic, but it can be made into new materials. However, PET processors make their own waste, and they're unable to reclaim environmental waste. So the current recycling modalities are simply inefficient and finite. Plastic can only be recycled in this way 3 to 5 times before losing most all of its value. In addition, they're unable to capture ocean waste. And as I alluded to, up to 30% of plastic is lost in the processing pathway and ends up in landfills or the environment. In fact, during customer discovery, these are widely acknowledged issues. We talked to many C-level executives from large PET processing companies. In addition, these processors will spend millions to increase yield by single percentage points because in terms of recycling and the general market, this equals millions and millions more in return. But can we do better? We believe we can. Enviro upcycles environmental and conventional waste using plastic degrading microbes. So let me explain a little more about the history of the technology. In 2016, a group of researchers isolated a bacterium that was capable of producing an enzyme that could break down PET plastics into its 2 precursors, ethylene glycol and terephthalic acid, in as little as 24 to 72 hours. However, there are some issues in applying this bacteria in its current state. On the bacterial side, there are limited studies, an unknown pathogenicity rate, and a slow growth rate, with no genetic tools with which to work in it. Now, what if we just took the enzyme and applied that on the plastic waste? Is that a solution? Well, simply, it's incredibly expensive to isolate enough enzyme to do this efficiently. In addition, there are issues with application and the thermolabile or degrading nature of the enzyme itself. Enviro wants to improve this not scalable option. To do this, we are producing a microbe that is commercializable with a fast reproductive rate, non-pathogenic nature that can self-sustain, that is, living off of the precursors it's generating, and can seamlessly integrate into the processor environment. A brief schematic might look something like this. Used plastic comes in and is broken down by our microbes into chemical precursors. These chemical precursors can, of course, then be turned into brand new plastics. However, the market for chemical precursors is not just plastics, but includes textiles, which is actually a larger market. These virgin plastics are then moved back into consumer stream and ultimately find their way back to us. In addition, because we are working at the molecular level, we can easily handle mixed and contaminated wastes, thus reintroducing ocean plastic back into the economy. Our microbe is deployed in an Enviro-designed bioreactor. An external bacterial chamber and an external buffer reservoir are connected to a main plastic degrading tank. This tank is capable of continuously receiving plastic input. Precursor-rich effluent is then collected in an effluent collection tank to undergo further purification and then sale. What we can do is bring ocean waste back into the economy and close the loop on plastics recycling. No longer will PET waste from processors end up in the environment. In fact, we can bring it from the ocean back into the pathway. In addition, because we are generating chemical precursors, our reliance on fossil fuels decreases greatly, thus eventually closing the loop on the recycling economy itself. In addition, the carbon emissions of Enviro are drastically reduced compared to other pathways. Shown here is our pathway, the Enviro microbes, current mechanical recycling, and the amount of carbon generated from fossil fuel generation of precursors. The market of Enviro, and this is important to understand, is not merely plastics. It includes ethylene glycol and terephthalic acid. In phase 1 commercialization, we will tackle predominantly US processor plastic waste. In phase 2 commercialization, a market worth $16.7 billion, we will tackle the US precursor demand. Importantly, the global precursor demand is greater than all of these at $82.8 billion per annum. So phase 1 commercialization. In phase 1, we hope to partner and license with PET processors. PET processors, on average, process 25,000 tons of PET. At a 30% loss rate, that's 10 million annually that goes to trash. By licensing our technology for $3 million per year per plant, they can increase their revenue by $10 million. However, phase 2 focuses on scalability. In phase 2, we will have a dedicated biochemical degradation plant. In this model, we will partner with chemical manufacturers and act as our own PET processor. Assuming an equivalent breakdown of 25,000 tons of PET per year, precursor revenue sales will equal approximately $28 million. In this instance, our customer then becomes the PET manufacturers themselves. So who are our competitors? It's important to understand that in the space, there is only one other biochemical company that is another high energy efficiency company, and they are Carbios. However, Carbios has opted for the enzyme-only approach. And as I previously alluded to, this has some high cost ceilings. That is, to produce enough enzyme to break down plastic on a commercial scale is incredibly cost inefficient. In addition, because they are applying a limited amount of enzyme and not applying continuously reproducing bacteria, their processing occurs in batches, leading to bottleneck issues and inabilities to process plastic efficiently and continuously. Currently, Enviro holds provisional patent on the application methodology. However, future IP can be extended to extended methodologies, bioreactor components, the engineered microbe itself, and engineered proteins, all of which are novel and protectable. Past milestones include winning the George Washington University New Venture competition, currently participating in this competition, as well as the Rice University Business Plan competition. I want to zoom in on a couple of key milestones for 2021 and 2022 that lead to an MVP. These are completion of microbial development, including optimization of enzymes and metabolic engineering, and in 2022, pilot testing for real-world applications. Our team includes myself, Sam Magaziner. My background is in synthetic biology and bacteriology. My co-founder, Emma Han, her background is in environmental and sustainability engineering. And our CTO, Ravish Rawal, who has 4 years of practical industrial engineering experience in product development. Together, we can bring this vision into a reality. In addition, our team is advised by a multifarious team, including a multi-time NSF I-Course mentor, the director of the GW Computational Biology Institute, and a member of Maryland's Department of Environmental Protection. Now, at this time, I'd like to thank you for listening and field any questions you might have.
Great, Sam, you have a full minute left, so I will tack that on to your Q&A. You can turn off, well, you can leave sharing on or off. I'll leave that up to you, but you now have 21 minutes for questions from the judges. Judges, just unmute yourself and have at them.
Hey, Sam. In this process, do the microbes or enzymes get defeated if like there's a Clorox bottle with a little bit of residue in there? Like, what are and I guess to broaden the question a little bit, like what are the shortcomings of this approach from a technical standpoint that you need to kind of cross to get it commercialized?
Yeah, absolutely. So to address the first question, we imagine that applying the plastic to the plastic degrading chamber would have to undergo an initial washing step. And this is fairly common in the plastic processing field. So that would remove the issue of a Clorox left in a Clorox bottle. The primary advantage you see is the ability to not be concerned about the label, the cap, and any other mixed plastics that might be in that feedstock, because our microbes target and degrade only PET plastics. In traditional processing pathways, they have to take these plastics, flake them, and then melt them down. So if you left in those contaminants, it would lead to issues of efficiency. In terms of the second part of your question, in major hurdles, the first one would be metabolic engineering of the microbe itself, and that's our current task. This will have to be efficient enough to overcome the limitations of the current enzymatic structure. That is, it has to be done at a faster rate. We have to eat the plastic quicker. That being said, there's virtually no other limitation given the fact that the microbes can continuously reproduce off of the precursors they're generating and produce an arbitrarily high amount of enzyme or an arbitrarily high amount of catalyst. In doing so, we overcome much of the issues our competitor Carbios has in limits with batch processing.
Thank you.
Hey, Sam, great job. Actually, that was one of the first times I've kind of understood the recycling trajectory. So I really loved how you explained that. So great job. Can you talk a little bit, go back to your phase 1 milestones and like, what are the kind of metrics or chunks that you're going to need to complete to get up to that phase 1? I'm trying to understand like how much money you're going to need to raise and like what you're going to need for each phase leading up to through phase 1.
Absolutely. So phase 1 commercialization, to recap, would include integrating into existing PET processing plants to handle the waste they generate and possibly auxiliary ocean waste. To get to that point, we have 2 primary steps that I outlined. The first is completion of microbial development. So we have an estimated budget of around $170,000 and a 6 to 12 month window for that, with 6 month leeway because science can sometimes be fickle. The second step, and more germane to real world employment, is a pilot phase. So this would be taking a small scale bioreactor and removing it from the laboratory and putting it in the PET processor environment. So in this case, it would be a large warehouse factory setting with a fixed temperature and continual noise and pollutants to see if we can bring the laboratory process up to scale. For that, we imagine it would be roughly $280,000 to complete a small scale pilot. In terms of advancement of that objective, we have actually acquired 2 letters of support from 2 of the largest PET processors in Mexico and the US, from the C-level executives themselves, promising both access to their facilities and interest in the pilot program itself. As I said before, increasing percentage yield of 30% is significant when they're already investing millions for single percentage points.
So then what would be your hope to get out of that pilot that would then say like, okay, you're moving on? Like what are you trying to achieve there?
Sure. So the hope of the pilot itself is real world degradation of real world plastics. That is, you take the waste the processor is making and you degrade it in the setting in which your pilot will be employed, that is the processor environment. So it's a well-known fact in any chemical engineering process that something that works in the test tube doesn't always work at a large scale. And so that's the primary hurdle. And so in terms of the quantifiable goal, it would be the same time and efficiency of degradation we see in a lab environment and efficient precursor isolation.
And is that a binary outcome, like it's going to work or it's not, or you go back to the drawing board, or how does that work?
Sure. So we imagine it to be a sliding bar because you can imagine a percentage as low as 10 and as high as 100. And these will depend on environmental factors as well as fluctuate depending on the plastic feedstock itself. So I cannot give you exact numbers, but that being said, we will seek to reach a median equivalent to the laboratory results. That's the objective of the pilot test itself. It also provides an opportunity for the PET processor who's allowing us to utilize their facilities, a proof of concept in their own backyard, so to speak. The PET processing community is a very close-knit one. And in that sense, we imagine this would greatly help the adoption of our technology.
Great, thank you so much.
Hey, I just want to chime in to say it's also a continuous improvement process. So from the pilot, that's the least efficiency that we'll ever have. And from there, there's not only microbial efficiencies that can be developed, but also mechanical efficiencies to understand temperature regulation and how that correlates to rate of plastic breakdown and how that correlates to sort of the tonnage that we can handle given each type of plant and their needs.
Can you guys provide a little bit of history as to why now for this technology? Is there some kind of recent, as you said, science is fickle. Anything in waste to value, which is a space that people have been working on for decades, is hard to do at scale. So is there some kind of recent technological breakthrough or science breakthrough that you're aware of that leads you to believe that now is the time to pursue this approach?
Right, that's a great question. So I would point to 3 things. The first being the core enzymes, really the active ingredients of the entire process, were discovered in 2016, or rather I should say late 2016, so simply 4 years ago. That being said, it hasn't seen a commercial deployment because directed evolution of bacteria in this way is often facilitated by deep phylomics and deep phenotyping, which is furthered by machine learning and various AI techniques that one of our advisors, Professor Keith Crandall at the Bioinformatics Institute, is helping us with. So technologically, those two elements are incredibly key. And tertiarily, I think that with the decreasing prices of oil, especially with the recent COVID pandemic, it's become more difficult for recyclers to compete using existing technologies. For this reason, they're more interested in exploring alternatives and additional revenue paths. Because remember, we're not competing with recycled plastics. We are simply competing with chemical processors, and our technology and products, terephthalic acid and ethylene glycol, can be applied to a wide variety of industries. So I'd say those are your big three. It's a change in both climate and then those two technological points.
Thanks.
There's also, just to add on, there's also a massive sustainability push on the demand side. Companies are trying to be more responsible, and they tend to live with, as Sam talked about, degraded regrind plastic, which means that they take on they compromise on mechanical properties, on optical properties of the plastics, and then they also jump through regulatory hoops with regrind plastic, as well as quality issues. What we're doing is sort of taking, reclaiming plastic that's out in the environment and turning it back into virgin-like plastic. And so there's no compromise on plastic quality while still getting that same sort of corporate responsibility checkbox ticked off.
Hey guys, it's Kim. Love the space and that you guys are trying to make the world better. So that's fantastic. Can you help me understand the business model of the space, like how the people you're selling into value your components? You were talking about, it was a $3 million price tag, but they could, be able to generate $10 million of value from that. Is the ceiling just unlimited? So they, no matter how much you produce, they can keep selling into the market, or how does that work?
Sure, that's a good question. So in phase one commercialization, where we are licensing the technology out to existing PET processors, it would be logical to say that the ceiling is the number of PET processors in the space. So in this instance, it would depend upon their yield, that is how much plastic they use in the course of a year, anywhere from 25,000 tons all the way up to 100,000 tons, and then how many processors actually exist. In terms of phase two commercialization, there is no ceiling. We can recapture the millions and billions really of tons that are in the environment, as well as compete and participate in the existing recycling streams. So that's phase two focuses on. It's really a two-step pathway.
And is a $3 million price tag for your product, is that market, or is that how much they're spending now, or how do I think about that?
Sure. So the paradigm currently is the majority of processors rent their equipment from recycling equipment manufacturers. And this is because a recycling pipeline is typically modular. You have a pathway that will lead to a washing belt, then you have a pathway that goes to the grinding phase, and then a pathway. And pretty much every company uses 5 or 6 different manufacturers of this equipment and connects it in their modular space. So when looking at our $3 million margin, that was both looking at the amount of money they could make from precursor sales and equivalent cost of existing equipment, including wash lines and extrusion chambers.
And so do they have the capital to be able to put towards that? That's not, I don't know how the industry works. I don't know how their business model works. Is $3 million a lot to them, or does that make sense to them and they would sign up for that immediately?
Sure. So depending on the size of the plant, their revenue can range anywhere from 50 all the way up to 100 million, really 200 million at your top end. That's just from turnover using the existing equipment. And every year, and we've talked to CEOs and operations managers and confirmed this, they have a small set budget to improve yield. Larger purchases, of course, have to be approved by board members. $3 million straddles that middle, actually, in between those two numbers, in terms of it's part of the allocated budget and the board members' review. So in that sense, we fall within their expectations. In fact, a lot of our marketing was based off of direct customer interviews we did with 15 of the 27 major PET processors in the United States and the largest in Mexico, who supplies all of Mexico Coca-Cola's bottles.
And I would like to add that even the biggest PET processor sites, they always talk about there are more demands than supply. So they are likely to be very happy to invest in anything that increase their yield.
Can you talk a little bit more about
Go ahead.
Sorry, Frank. Can you talk a little bit more about energy efficiency of the approach? How much heat does it require? Other kinds of things. I know you showed a slide on that, but I'd love to hear more about it.
Yeah, absolutely. So the first thing to remember is that traditional PET recycling, you have machines that are heating up water to clean bottles. You have machines that are then grinding these into tiny flakes at a high torsion. You then have machines that are heating them up to plus, I believe, 200 degrees C to melt down the plastic bottles and turn them into pellets. So each step of the traditional recycling pathway, you have a high energy cost to high machineries. In chemical recycling, which we touched on a little, and it was mentioned in the slides, you have to heat up methanol and plastic to incredibly high temperatures to undergo that depolymerization reaction. These are temperatures in excess, once again, of 200 degrees C, right? And have to be maintained for the entire length of the reaction. Our technology requires that the bacterial chambers and main plastic degrading chamber be maintained at 37 degrees C continuously. So right there, you have an incredibly lower energy input. The only inputs really are water supplies, which is already less than the current washing and grinding strategies, and that 37 degrees C. Now, Rob, actually, would you like to comment more on that, given that you're the bioreactor expert?
Yeah, so the process isn't really exothermic from what we've seen. And so the temperature regulation is just based on ambient conditions, but it's not super energy intensive. The large energy draw is in the pump systems, the motor systems around the agitators, and then the automated valves. Compared to all the other machinery Sam touched on, it should be almost negligible.
And is the process very sensitive to temperature fluctuations? That's one of the hard things about continuous processes, especially as you scale up. I'm curious if if there's some variation around 37, does the process degrade?
Sure. So 37 is the degree Celsius that bacteria most likely replicate at and are happiest at. It's physiological temperature, body temperature. That being said, the enzyme functionality, which is the real question, it can function, I believe, as low as 14 degrees C and as high as 42 degrees C. So you have quite a bit of leeway within that range. The bacteria themselves, of course, can sustain much higher and much lower temperatures. You might have some die-off, but being that they're self-replicating, that's not too big of a concern. That being said, you're correct to point out that the main concern and energy cost is the regulation of that 37 degrees C, because it maintains the efficiency of the enzyme itself. I would also just like to tack on, and I didn't mention it, I had mentioned that fossil fuel generation of precursors, that is using petroleum naphtha to make ethylene glycol and terephthalic acid, is incredibly energy intensive. Not merely because you're pulling the fossil fuels out of the ground themselves, but the process that it takes to then develop those chemicals. So with our pathway, we circumvent that, which is a more macro effect, but something that's important to consider in the entire climate and carbon emissions pathway.
We have 6 minutes left, so more questions?
I think you touched on this, but Care Bios, they're a public company. They've been doing this for a while. What's the core thing that makes you guys better than what they have?
Sure. So I'd say there's probably two. The first one is a historical reason. Carbios was founded in early 2011 before the identification of these core enzymes. That meaning that the enzymes they're utilizing in their existing systems are not specific for PET and operate at lower efficiency. Having read rigorously their patent literature, they function anywhere from 20% to 40% efficiency depending on the temperature, which of course is not optimal. In addition, because they are adding an amount of enzyme that's fixed into a fixed volume of liquid in order to optimize the reaction, there can be little variability in the plastic that is being fed into the process. As soon as you introduce variability, the efficiency might plummet because you don't have an artificially high or arbitrarily high amount of catalyst. Our process circumvents that issue by having bacteria that are continuously secreting this enzyme at arbitrarily high amounts. And therefore, we can process continuously mixed and contaminated wastes like ocean plastic. I'd say that's the number one.
Thank you. That's helpful. And even they are pretty far away from commercialization, correct?
I believe so. So they recently received a large grant from a European foundation because they are based in France. I forgot to mention this. And Europe in general is much better at recycling. And so it's not entirely surprising. But what excites us is that it shows there's a huge interest in this technology. They've managed to secure partnerships with Nestle as well as L'Oreal to produce and process their own plastic waste. We'd like to implement that in a more efficient manner here in the United States and expand our products to ocean plastic, or rather inputs.
Thanks.
Yeah, you're welcome.
Can I ask one more question, Frank, or are we done?
Absolutely. Go for it, Jen.
So you guys have a super impressive team. Where are the gaps and who do you hiring next?
Just give me a moment to think about that question. Well, I think the first hire we would like to make is a secondary dedicated research technician to increase the speed of research. That would enhance the timeline for microbial development and pilot testing, simply speed things up. I think there might be a small gap simply on the financing side of things, acquiring a dedicated member to handle financing and budgeting. But that being said, so far we've been fairly proficient. However, that would be probably a next key hire as well. We're readily armed with our advisors in that we have members of academia, industry, and regulation in the EPA itself. That being said, moving forward, I think we would like to acquire another advisor who exists more directly in the recycling space on the commodity side. So perhaps the chair of one of the major PET processing associations like NAPCOR, or perhaps a member of policy who exists down in the Washington, DC space.
Great, thanks.
Final question? If not, feel free to share unvarnished feedback, good or bad. We're here to help these teams, so it's all good.
Yeah, I mean, I think the couple things that I'll say is like the obvious thing is like, does it work or not at scale? And that's what you guys are very focused on. Kind of Jenny's question earlier, like I would encourage you to, and maybe I'm missing something, but just make sure you get the team members and expertise on scaling the manufacturing side of it. My old partner Yoshko is at Sophie Nova in Paris and runs a fund that focuses on this area. I'm happy to introduce you to him. He's a terrific guy. He's a PhD in chemistry, knows it very well. But listen, this is a massive problem, so I love that you guys are working on it. People have talked about this as a potential solution for a long time. It sounds like the science has evolved a lot. I'd love to see it work. So let me know how I can help at all.
Oh yeah, thank you. That'd be fantastic. I take it from my entire team and myself that'd be incredibly valuable. And also thank you for your feedback.
Sam, I can put you in touch with John if you want. So just reach out and we'll make that happen. We have 1 minute left. Anyone want to share anything else?
Echo what John said. I think also, one of the things I thought you might show, but you didn't, is sort of the very micro scale tests you've done, or, lab scale. Here's how it works even at a lab. Obviously need to test at a very small scale. It's very difficult to get to even things that work in a lab. It's very difficult to scale them up, but I thought you might show a little bit more about those small scale tests you've done, but it's possible that you're just not there yet.
Okay, we have a few, but not well recorded, which is the predominant reason they weren't shown, but that's a very helpful suggestion.
Yeah.
Thank you.
Yeah, I mean, I just think, echoing what everyone's saying is that when you're pitching investors, like they're spending the whole time saying, like, well, this has to work, it has to work. It's so binary. And so anything that you can do, small little things along the trail that show that, there's indications that this can work, I think will just weave into your narrative a lot of confidence, because we spend the whole time thinking, oh, this sounds amazing, but if it doesn't work, right? So
Thank you.
Thank you, Jenny. Sam and team, thank you guys very much. Let's give them a round of applause. Feel free to do it virtually. Snaps. It all works. It all works. Great. Greg,
It's 2 o'clock.
On behalf of all of us, really sorry about that. I'm sure I know that was frustrating getting in and out and in and out. Are you ready to go?
I actually don't think so. So I'm in as an audience member, but I don't know.
No, you're
if
not. No, if you can talk, you can present.
Frank, we need Greg's presentation. You try to see if you can load it on and share the screen. Or you know what, just forward us the presentation. I haven't received it.
I actually just did. I sent an email a couple minutes ago. So hopefully.
Yeah, it's not. If you send it to many of us, I haven't received it in my email yet.
Okay. In the interim.
My inbox yet.
Yeah, it should be there. I sent it at 1:55. So hopefully it'll get there.
Glenn, are you ready to go in the interim? Glenn?
Glenn, you're muted.
Yes, I'm ready to go.
All right. Thank you. Really appreciate your flexibility. We put Greg through the ringer in the last 25 minutes. So I appreciate that. All right. Thank you to the Enviro team. Glenn, feel free to share your slides and you will be in control.
Okay.
Greg, I'm just going to mute you.
Bear with me for a second.
No worries.
Okay. Please let me know when you're seeing my screen.
We can see it. Judges, can you see it? Yeah, I see a thumbs up from Jenny. All right, whenever you're ready.
Lovely. All right. So I'm Glenn Simmons, CEO and founder of Portable Diagnostic Systems, and you see my co-founder, Michael McRae, CTO of the company. Mike and I share a passion for solving healthcare problems through technology, innovation, and entrepreneurship. Technology that we developed has been the basis of several startups, including LabNow, Sensidex, or Aliva, and now Portable Diagnostic Systems. Portable Diagnostic Systems is a biotech startup developing next-generation drug detection technology for law enforcement, workforce, and clinical drug testing. More people are driving under the influence of drugs than ever before. Some estimates are as high as 13 million drug-impaired drivers on the road each year. This has led directly to an increase in fatal motor accidents. In 2016, 43% of fatally injured drivers with a known test result were positive for a drug, and more than half of those were positive for 2 or more drugs. In this year, for the first time, there were more fatally injured drivers positive for drugs than alcohol. Compared to the 13 million drug-impaired drivers on the road, only about 55,000 law enforcement officers have the training necessary to recognize drug impairment in a traffic stop. And only about 8,000 are certified drug recognition experts that have advanced training to differentiate drug impairment from medical impairment. Determining if a driver is impaired by a drug is a medical, scientific, and legal challenge for law enforcement. Establishing probable cause for arrest can be subjective. Ruling out other forms of impairment and ruling in drug impairment is conducted in a post-arrest process that takes considerable time, resources, and expertise. Each of these steps is at substantial cost in terms of time, money, and resource allocation. In this process, it takes about 3 hours to go from the point of arrest to the collection of a blood sample for toxicology testing. During this time, the concentration of the drug in the body can drop below detectable limits. Backlogs in toxicology testing can mean that the test results aren't back in time for the court case. Losing these cases can be a significant problem for police departments that operate on limited budgets and staffing. A roadside test could make this process more efficient, but current roadside drug screening tests are notoriously inaccurate. These tests, primarily based on immunochromatographic test strips, send people to jail that haven't committed a crime. And for this reason, law enforcement does not widely employ them. To date, the technology gap for roadside drug testing has not been filled, and portable diagnostic systems aims to do just that. Introducing the Integrity One analysis system, next generation drug screening technology. The Integrity One gives law enforcement the ability to accurately determine the presence or absence of drugs in the driver's oral fluid in under 5 minutes, well within the time frame of a typical traffic stop. This technology will allow law enforcement to make objective, data-driven decisions in enforcing DUID laws, which can remove subjectivity and bias from this process. What's the underlying magic? It starts with better antibodies. Our custom-engineered single-domain antibodies, or nanobodies, are heavily screened against interfering substances during production. This leads to fewer false positives. The nanobodies bind with the drug in the sample inside our microfluidic device. Here, the sensor, which consists of an array of IgG antibodies, only binds to the nanobody drug complex and won't capture the nanobody or drug alone. This further enhances specificity to target. After a wash, the captured nanobody drug complexes are detected by a fluorescently labeled IgG antibody specific to an epitope tag on the nanobody. Our novel microfluidic cartridge facilitates recirculation of both the sample and the reagents over the sensor, and this allows us to extract more of the target molecule from the sample. This is key to better sensitivity and precision. Our preliminary drug panel is one of the most comprehensive on the market and includes 12 drugs of high interest in DUID enforcement, as well as test and sample validity controls. Results are pushed to our mobile app that include inputs for documentation of impairment signs and symptoms, including video evidence to support the drug test. This represents powerful standalone evidence in the event of test refusal. The drugs of abuse testing market is projected to reach almost $12 billion by 2025. This market is broadly segmented into 3 categories: law enforcement, workforce, and clinical drug testing. And we want to be in all 3 of them. We selected law enforcement for market entry because the FDA does not regulate drug tests labeled for law enforcement use only. We used Canada as an analog to estimate the size of the market for this technology. Canada's bill C-45 legalized cannabis, and the following bill, C-46, allocated $81 million to combat drug-impaired driving and purchase drug detection technology. By scaling Canada's budget to the population of the top 10 GDP countries around the globe, we estimate the global serviceable addressable market to be approximately $4 billion and the obtainable market to be approximately $1 billion. There are 3 major competitors making instrumented drug test systems specifically for law enforcement. The main problem with these technologies is that they have limited test menus, questionable accuracy, and high cost. In the end, these expensive solutions that cost between $4,000 and $5,000 provide little value over immunochromatographic test strips, which have been on the market for years and don't require an expensive instrument. Selling to law enforcement or any government organization is all about winning the procurement game. You have to have the lowest price and you have to make a sole source argument. We aim to do both. We have strategically priced our instrument substantially lower than the competition with competitive pricing on the consumable items. The instruments will have significant lifetime value that will drive income through recurring sales of the consumables. Other income streams would include a subscription to our impairment app, an annual service and support contract, and access to the data and statistical information collected on our platform. Our business model is simple. We aim to sell multiple Integrity One analysis systems and consumables to police departments in the United States and around the globe. And we would like to put one in every single police car. We anticipate that each police department would buy at least 3 units, 100 test cartridges, and a service and support contract, yielding approximately $18,000 in revenue per sale. If we were to achieve at least 1% market penetration in the first year, we could generate $3.2 million in revenue. And we expect to hit at least 25% market penetration within 5 years, bringing in between $100 and $350 million in revenue in the US law enforcement market alone. By expanding globally and exploiting other market segments, such as workforce and clinical drug testing, we can likely double or triple that number. This is our pathway to becoming a billion-dollar company. Our path to winning involves completing our MVP this year and getting it into the hands of law enforcement at the earliest possible time point. We anticipate a global launch in all drug testing market segments within 5 years. We're trying to raise about $350,000 to complete our MVP, and we think it will take about 1 year to do that.
1 minute left.
The take-home message is this: roadside drug testing is inevitable. Law enforcement is actively looking for a solution, and this is evidenced by pilot programs initiated for testing such devices all over the country. The market is not regulated by the FDA, and our instrument is a 100 times better solution. We have a more comprehensive drug test panel. We use custom engineered antibodies that reduce false positives, and we're able to do it at a lower price point. With the legalization of cannabis and the widespread use of opioids and other drugs, people are dying on the roadways for DUID. And this there's never been higher government or societal interest in solving this problem than now. We have the right team and we have a lean plan to get it done. 350,000 is a drop in the bucket, and there's very high growth potential. Our plan to become a billion-dollar company involves expansion globally and exploiting those other market verticals. We are portable diagnostic systems. We bring the lab to you. Questions?
And you are right on time. And thank you for ending on time, and you have 20 minutes for Q&A from the judges.
Can you just explain where would the device sit? Would it be at the precinct? Do you anticipate they'd be in some patrol cars actually down at the roadside? Can you talk about the actual sort of use case?
So both. Right now, the model is that basically suspected impaired drivers are brought back to the police department for a medical exam. And then they're transported to a hospital for a blood test. And lateral flow test strips can go in the vehicles, but there's a push right now to put instrumented drug tests in vehicles because nobody wants a police officer making a subjective reading of this lateral flow test strip. So we want to price our instruments lower so we can put them in the police cars, not just the precincts.
Great job on the pitch. So you talked a little bit about procurement. That's obviously a pretty long sales cycle. So can you talk about, as you're ramping up for the MVP, what you're doing to build that pipeline and maybe already establishing relationships with distributive?
Yeah, sure. So there's pilot studies that have already been initiated. So in our customer discovery efforts, we're focusing on the current pilot studies. And from talking to those administrators of those studies, we're trying to figure out who's going to do the next one. Right now, the Michigan study is the largest oral fluid drug testing pilot in the world. The objective of the study is to evaluate saliva as a diagnostic medium. It's not to evaluate the technology, but even so, they bought 112 Abbott Sotoxa mobile drug test platforms at a cost of $6,000 each. And that is not to implement the technology statewide. So we're really focusing on those pilots, and we want to find out who's doing it next so that we can be involved. And normally the pilot studies come with the budget to buy the technology. As far as getting ready for distribution, we do have a manufacturing plan, and there's maybe 20 or more distributors that already sell tactical equipment to law enforcement agencies. It's a multi-billion-dollar industry, and I think we could just tie into any one of them.
Gotcha. Thank you.
Can you talk to what is the MVP versus what you've been doing now, and how many tests have you done, and some thoughts around the results of those tests in terms of where maybe it hasn't been accurate?
Yeah, sure. So far, we are currently self-funded. So the reagents are very expensive, and we've used donated reagents from other companies where we have friends and supporters. We've done a lot of tests for protein detection, just to look at, function of the microfluidics and the handoff between the instrument and that sort of thing. And we did a lot of work with just straight up IgG antibodies because they're very inexpensive. We were able to run standard curves and get a perfect 4-parameter logistic regression. We were able to detect unknowns. We were in precision studies. We had precision of around 3% across the board. So we have excellent precision on this. It could be a quantitative device. But the next step for us is to develop those drug assays on our panel. And to do that, we need more resources. We need a laboratory where we can do the work, and we need to be able to order all those reagents and process them. So Mike and I have both worked in our academic work and in our just affiliation with startup companies, developing drugs of abuse tests. So we are 1,000% confident that we can do it. We have done it specifically for Sensodex and working with the McDevitt lab at NYU, where we've done projects for the Army and looking at threat detection with a variety of drugs and small molecules. So I think that our approach is significantly different than what we did before, but we're very confident that we can execute it.
Hey, this is John. So you mentioned a couple of the other companies in the space. It seems like there's been a kind of steady technology leapfrogging in the space. So really 2 questions. One, like, what's the long-term persistence of your technology, and that, like, you're confident it doesn't get leapfrogged in another 2 or 3 years, whatever. And then second is, like, how are those other companies doing? Have they done well in this market with the initial technology? And if not, like, what's the holdback?
Well, really what's enabled this technology is a fairly recent development. It's the renaissance of shifting away from blood and urine to saliva as a diagnostic medium. So most of the pilot studies are evaluating just that alone. They're not really technology evaluation studies. Some of them are, but so this has really made it possible to put these instruments in the field to detect drugs of abuse and other things. So we're exploiting that. We're also exploiting advancements in antibody engineering and microfluidics, which has come a long way over the last couple decades. So this is really the right time for putting a technology like that out there. But that being said, we can't sit still. And a lot of there's different laws in different states. Some laws for impaired driving are, if there's any drug in your system, it's illegal. But others are more nuanced and require you to connect impairment to the presence of a drug. And so we're working on tools on the impairment side because we want to be able to do that. We want to be able to link those two things together, and that's some of the behind the scenes development that I think will keep our company relevant for a long time.
Thank you.
Other questions?
Yeah, I'll ask another question about, I assume that for the hardware using off the shelf, can you talk a little bit about, the actual hardware device? What are the margins on that, and kind of what's the model around that? I heard you say subscription down the road, but the actual hardware device, what are the BOM costs, etc.?
Yeah, so right now it costs us about $600, a little less than that, to make an instrument that's basically colorimetric and not based on fluorescence. It's about $1,000 to make one that's a fluorescence-based reader, and we're wanting to keep the price very low. So for the fluorescence-based reader, we're looking at selling it for a little over $3,000. That's really what the margins are. For the cartridge is depending on how many drugs we test for, but between $5 and $8 to produce. And all of these numbers that I'm reporting, they don't benefit from the economy of scale. This was just us buying stuff from optical companies and DigiKey and kind of just totaling up the bill of materials. So we do expect to get volume pricing, and that's going to drop the price down quite a bit and improve our margins.
Cool, thanks.
There's been a lot of debate as to whether Uber and Lyft reduce DUI and DUID. Do you have a view on that?
I do. I think these ride-sharing services are great because if you go to a bar or do drugs, and you can just pick up your phone and get a ride home. If you're forced to drive your vehicle, then you're putting me and my family at risk when I'm driving down the road. And that's been one of my biggest motivators. This was an area of science that I thought I could make a big contribution to, and a problem that directly keeps me and my family safe when we're driving around in our minivan. So, you know, I'm really motivated by that, and I think these ride-sharing services are a good thing. They're advocated by, I guess, you know, Mothers Against Drug Driving and drunk driving and drugged driving, things of that, groups of that nature. So I think they're good. I think the same with Tesla, you know, putting out autonomous vehicles is going to reduce this problem and hopefully reduce accidents as well when they further debug, you know, their autonomous driving software a little bit more.
But you, I guess, connecting that with your earlier statements, you think there's enough of a window here to build $1 billion company based on this solution?
Going away anytime soon. And not only that, not just driving, but I mean, think about workforce drug testing. We were talking to a company in San Antonio who had insulation installment equipment that they had to transport around in F-150 pickup trucks. And I guess the guys that were doing the installation work and and driving the trucks around were constantly basically getting high and then, you know, interacting with customers and, you know, they're putting their company at risk. And so we think that companies like that will be interested in this technology. And right now they have to send their people off to, you know, a company like LabQuest or some of these others to get their blood drawn and all that kind of stuff, which takes them away from work. And we think that we could put one of their instruments in their company, do a quick saliva test, and, you know, keep their company protected. And there's the Department of Transportation has recently, just very recently, this last year, authorized oral fluid testing for safety sensitive positions like truck drivers and airline pilots and things of that nature. And I think it's just a matter of time with the improvement in the technology, like proving that a point of care device like what I have developed is analytically sound. That will allow that type of testing to extend to what we're doing. So I think there's just huge room for expansion in that space. And that's not even touching, you know, the clinical aspects of pain management and neonatal toxicology, emergency medicine, first responders, all these clinical applications for drug testing, where you really want a portable, quantitative, accurate technology so that you can figure out what's going on with an individual. It's just that requires FDA approval, and there's other regulatory hurdles for some, like Department of Transportation, workforce drug testing. So we want to enter in the law enforcement market and expand to these other markets over time when we can secure the regulatory approval. And it just gives us a lot of room for growth and then expanding globally. I mean, the entire globe is dealing with these issues.
Hey, I'll ask another question. You had talked about the reagents being super expensive and the $350,000 I think you're looking for now to, you know, set up a lab and get to MVP. Does that fully get you there, or can you break down how the $350,000 is going to be used, and does that actually get you to, you know, pilots?
It does, because what we can do with that money, first of all, about 2/3 of it is our operational cost. We need a small footprint. We're looking at Princeton Biolabs right now. New Jersey has this program called New Jersey Ignite. And so basically they pay for 9 months of rent, and you're on the hook for 9 months. So that will save us some money. It will give us a couple lab benches and an office space for a very reasonable price. And that's included in that amount. And so, and then most of the work that we would do is just the assay development work. The reagents are actually not that expensive, but they're expensive if you're paying for it out of your vacation funds. So I'm just eager to get funded so I can, my wife will be happier about that too, and we can easily do that work. And that will give us preliminary data. We can then apply to SBIR, STTR, grants that are, you know, directly in the space. And we know that NIDA is hungry for the technology that we're developing. They recently had a challenge for how could you improve substance use disorders. And so we know that we could likely acquire funding there, because driving under the influence of drugs, as being pregnant and doing drugs, it's a high risk kind of behavior that would lead you to substance use disorder. So there's a lot of funding in that space, and we could help, that would help us develop our product further.
Other questions? And if not, if anyone wants to shift into feedback, that works too.
I'm happy to give some feedback. Great job on the pitch. I really liked it. I spent part of the pitch trying to understand what was, did this include alcohol or not before you kind of mentioned it? And I feel like that's a great way to kind of relate to the audience, be like, yeah, I mean, breathalyzers have been out there forever. It's contributed to, cut down of X amount of whatever, of accidents, but no one's addressing the drug issue, which, with legalization and whatnot is going, I feel like it could have been a little tighter there. So it's like in the beginning, I really get a sense of like, kind of apples to apples. Like I understand how breathalyzers have kind of changed the landscape, but I wasn't sure about drug and if you were including it. So I would maybe just put that earlier in.
For a preliminary screening test, we absolutely could test for alcohol. It's just we're very focused on the drug issue right now. The interesting thing about the breath alcohol levels, BAC at 0.08 or whatever, directly corresponds to impairment. They can scientifically link it together. But with drugs, that's not necessarily the case. And the other problem with drugs, the complication is that if you detect drugs in your system, that doesn't necessarily mean that you're impaired. So there's just a tremendous amount of nuance around it, and the laws are all different. And we have a strategy for that in developing our impairment app that would go along with the drug test. And I think that they're not directly, even though they're kind of in the same space, they're just not the same animal at all. But I agree with what you're saying in that they're more relatable. It's just, it's such a complex issue. I don't think I can explain it in 9 minutes.
Yeah, so, I get that. This is more just a positioning with people that don't know your space like you do. And so it's really just saying like, I think everyone on this call is like really familiar with the breathalyzer, right? So just try to make it maybe a little bit more relatable. I mean, I don't want to speak for other people, but that was like, I spent a bunch of time trying to kind of figure out the difference in my own head, so.
Got it. I will definitely work on that. Thank you.
I think similar to the last pitch for me, like glad you guys are working on this. It's a big problem. And I was aware of the kind of success that breathalyzers have had against the problem for alcohol. And I agree with Jenny, that's good feedback of like, the context on it and framing it in relation to what you guys could do here. For me, from an investment standpoint, hardware is tough, and we've done a number of investments in the sector, and the challenge is you're constantly getting leapfrogged, and someone out of China comes out at 1/10 the price, kind of thing, or wherever. So I think your answer on the like, what's your long-term sustainable advantage? I think needs a little more meat, a little more crisp. I didn't really get the aspect of why tying in the legal aspect of impairment versus like it's in your blood system. But it's a big problem. I think it'll if you can help improve it, it'll save a lot of lives, and hopefully there's also the benefit of people who have drug problems, get help. It's often the case that someone has an issue and something like an arrest is the catalyst to propel them into treatment and other things, or have other people help them on that journey.
That's exactly our argument tonight, as we're securing, funding through the SBIR programs. I can attempt to explain. I know this is feedback, but I'm happy to attempt to explain the nuance between the drug problem versus the alcohol.
It's fine. I'm just giving feedback now, but appreciate your willingness to do that.
Any final words? I know I sound like Lawrence O'Donnell for saying this, but John Elton has the last word. All right. Thank you. Thank you, guys. Well done. Appreciate your sharing that with us. And last but not least, Greg and the Precision Radionics team. And again, thank you for your rolling with the punches today. Greg, if you could bring your slides up, here they come.
Okay, great. And great. Yeah, that was no problem with the Zoom thing. We got it working. That's all that matters, you know.
Good. So you have 9 minutes to present, as you know, and then we'll do 20 minutes for Q&A and feedback, time permitting.
Right. Okay, great.
Right.
I'll start now.
Whenever you're ready.
Yep.
Go for it.
Right, thank you. So we are Precision Radiomics, and we do 3D imaging of bone strength to accurately diagnose osteoporosis and improve bone health. The problem that we're addressing is the underdiagnosis of osteoporosis. Did you know that over 50% of patients with osteoporosis, which is a disease of weak bones, go undiagnosed and untreated? In the United States, there are approximately 50 million people who are affected by osteoporosis. This results in 2 million fractures annually in the US. That causes major surgery, costing the US healthcare system $20 billion per year. On the bottom right, what you're seeing is a patient who sustained a broken hip. This is actually an x-ray that I read when I was in the clinic recently. Subsequently, they had to have a hip replacement because they suffered that broken hip after falling. The mortality after you suffer a hip fracture is as high as 20 to 24% in the first year after that fracture. And osteoporotic fractures result in hundreds of millions of lost days from work annually. So why does this problem of underdiagnosis exist? Well, it's because physicians lack a sensitive test to assess patients' bone strength. The current standard of care test is DEXA. And this was actually a technology which was invented in the 1960s. It was first described in a paper in Nature in the 1960s. And it estimates bone density from the grainy two-dimensional image that you see in the bottom right. And we're still using this diagnostic test today. There are many false negatives with this test. Our solution to this problem of underdiagnosis is a 3D test of bone strength. So we have developed software that computes bone strength using as input patients' CAT scans or their MRI scans. We apply our algorithm, which is a combination of deep learning and computational biomechanics, and we generate a patient-specific bone health report. This can be done for any bone in the body. In terms of the market opportunity, we view it as being almost $10 billion in the United States and $700 billion globally. This is because of the large number of patients who are affected by osteoporosis. So this includes the aging population, anyone over the age of 65. In particular, women are actually more affected than men after menopause. This includes patients who have kidney disease, diabetes, cancer, or inflammatory arthritis, such as rheumatoid arthritis, who all have weakened bone. And it also includes the orthopedic surgery market. The orthopedic surgery market is actually our beachhead market, and in particular, we are targeting spine health or back health. In the United States alone, there are 500,000 spinal fusion surgeries that occur per year. And this is a staggering number that I had not learned until the last few years. Approximately 1/3 of these patients have a postoperative complication such as a spine fracture, which is what you're seeing in the upper right-hand corner of your screen. So this patient had spinal fusion hardware placed in the lower part of their spine to fix a deformity. Shortly after the surgery, they suffered this postoperative spine fracture. So this angulation in the spine is not normal. So they had to undergo another surgery to remove all this hardware and then place new hardware in to extend the instruments up higher to correct this deformity. If the surgeons knew that this patient had weak bones at baseline, they would have performed a different surgery. They would have either gone higher at the beginning, or there are different types of screws and metallic instrumentation that you can actually use. Currently, what the surgeons at NYU are doing to estimate bone health, and I know this because I'm an actively practicing radiologist myself who works with them, is that they take the CT scans and they are manually drawing this circle on a portion of the spine and getting some estimate of the level of grayness in the image. So there are obviously many problems or limitations to this approach. It's not reproducible. It doesn't sort of take into account the structure or the 3D shape of the bone. It doesn't account for the heterogeneity within the bone. So we can actually provide them with the information that they need by quantifying bone strength using our methodology. And we can do this for any bone in the body and including within the spine. We are currently doing a collaboration with the spine surgeons at NYU, doing a big retrospective study looking at all patients who had this type of surgery in 2017. And also thanks to feedback from one of the judges in the semifinals, he recognized that in the value chain here, the spinal implant manufacturers would have interest because this could sort of improve the performance of their spinal hardware and sort of with the surgeons. So we actually reached out after the semifinals to one of the major publicly traded spinal implant manufacturers and had a conversation with them. And it's actually very, very promising. So that conversation is ongoing. In terms of the competition, there is competition out there. We are, however, the only solution that measures bone strength in 3D that can be applied to CT and MRI scans. We have an FDA 510K application in a rough draft form that we hope to submit. And through our work, we've shown evidence for the detection of currently occult osteoporosis patients. In terms of what we've done so far, so this did not happen overnight. My colleague, Chamath Rajapaksa from the University of Pennsylvania, we actually met in 2008 at a conference in Berlin. And then when I did my fellowship at University of Pennsylvania, we started working together. So that was 2009, 2010. Over the last decade, we've secured over $12 million in National Institutes of Health funding, which has allowed us to develop this technology. We've published over 100 papers and actually tested it to date in over 400 patients. A patent application was submitted in late 2018. We don't know the outcome of that yet. Hopefully we'll hear, it should be later this year. Like I mentioned on the prior slide, we have a rough draft of a 510K, and we are aiming to develop a commercial grade software this year. And like I said before, we also have ongoing studies with orthopedic surgery, rheumatology, and also the oral surgery departments. In terms of the revenue stream, we view it as coming from a few different sources. So the first source, and this has actually somehow risen to the top thanks to the feedback from the judge and semifinal judge, is surgical implant manufacturers. So this would be royalties from licensing to the surgical implant manufacturers or exclusively to one manufacturer in the orthopedic market. We actually want to go after the bigger market, which would just be physicians in general, and giving them sort of a software as a service. This would be an annual subscription fee to a cloud-based service, plus a per patient analysis fee. Most importantly, in late 2019, Medicare, which is the main federal payer for health insurance, actually approved reimbursement for CT-based bone strength test. So there's actually now a way for hospitals to get paid for this after they offer our test. And finally, we view a stream coming from pharma, as we can provide them with outcomes from their clinical trials for drugs that they're developing, or real world outcomes from drugs that already exist in the market and that are approved and they're selling. In terms of the go-to-market strategy, the most important right now is, in terms of us, is the technical pathway, which we need to develop that commercial grade software. And then in 2021 and 2022, we aim to have the results of these larger clinical studies that we're doing with surgeons and with some of the endocrinologists and rheumatologists. The regulatory pathway will also be critical. Our goal this year is to submit the 510K and obtain the 510K clearance next year. And then obviously in terms of business development, we want to start getting this product out there. So we want to distribute it to our research colleagues at academic medical centers who we know from conferences and from just working in the field. After we obtain the 510K, then we actually want to enter the clinical market and begin selling it to the orthopedic surgeons and obviously to the other market, which is the aging population, postmenopausal women. And in there would also obviously be the surgical implant market as well, included in the orthopedic surgery market. The competition would be very critical for us because this could accelerate the development of the commercial grade software and allow us to work with a consultant to get this 510K application in, and everything else sort of hinges on these two things. So I'd like to thank you very much. This is my colleague Chamath Rajapaksa from Penn, who's on the call, and we're currently in the search for a CEO to help us bring this forward even faster. I appreciate your time.
Perfect timing, Greg. Thank you very much. Judges, 20 minutes for questions and feedback.
Hey guys, Greg, that was terrific. Thank you for that. On the, I think one of the first slides you had sort of the status quo. Is that a X-ray that you showed? And then you're moving to different modalities like MRI and CAT scan?
Yeah, exactly. Yeah, so it's basically an X-ray based technique where there's a detector behind the patient and there's a source that's emitting photons, and then it's creating the sort of shadow on the detector. And yeah, it's an X-ray based technique, correct?
Aren't CAT and MRI a lot more expensive? Could you talk about, and maybe it's worth doing it because it's such an important and expensive problem when it happens, but you know, what's the cost implications of moving from X-ray to CAT scans and MRI?
Yeah, sure. So so there are basically two-part answer to that question. The first part answer is that one, we were, and this has been with the help of the coaching through the Entrepreneurial Institute, that's why we're actually targeting the beachhead market of the orthopedic surgeons first, because they order preoperative CT scans on all their patients anyway, and they're trying to estimate the bone quality. So our solution sort of fits right into their workflow. This is how we're going to get our foot in the door and show that we have value. The bigger market, which is sort of the there are only 500,000 spine surgeries that go in the U.S. per year, but the bigger market, which is actually the one that we really want to target, is the elderly population, which is 50-60 million people in the U.S. a year. So that market, which is the much harder market, it's the blue ocean, if you will, that will involve indeed doctors changing behaviors of the doctors. So now they have to order another test, which is the CAT scan or the MRI, which Medicare, the cost for that is $400, $300 to $400 versus $40 to $90 for the DEXA. So to address that sort of discrepancy in price, we did this economic analysis, which was, I kind of went through that slide very quickly, where we showed that actually the best way to use our test was actually not to replace DEXA, but to do it in combination with the DEXA, sort of as like a secondary line test. So a patient would receive it like once every 5 years. Another way to think about it would be like when you think about like your workup for like heart attacks or cardiac health. There's actually so many different types of tests you can get. Like initially there was only total cholesterol, but now they have the different types of cholesterol. Then you can go on to get like exercise treadmill testing or nuclear stress testing. They don't do all those advanced cardiac techniques on everyone, but they sort of do it along the different pathway of like in terms of risk stratifying you. So what we're saying we want to do for that patient population, and I didn't go into too much detail, but is that we actually want to introduce a test to better sort of risk stratify those 50 million people who are currently just placed in one bucket. And we want to say to doctors, like, look, here's another test that gives you a little bit more information about what is their status. Should they be put on a drug? Is that particular drug working for that patient? And so that economic analysis that we did, we showed that it was basically worth it to pay up to $1,000 extra for every patient once every 5 years. And you would actually reduce the number of societal fractures by 12%, because you're preventing all these hip fractures, wrist fractures, spine fractures, and all those surgeries cost $10,000 or $20,000 a year. So it's almost like one of these, you might have heard like a number needed to treat analysis. It's kind of like along those lines. Sorry, that was a long-winded answer.
No, that was helpful. And then maybe just a quick follow-up on, so you get the MRI or the CAT scan, and you're using machine learning to estimate bone density. How defensible is that? Like if I gave a training set of 100,000 images with clinical outcomes around it, would a grad student with a machine learning background be able to get pretty good results from that, or what's the leap forward on the ML side of it?
Got it. Right. So the machine learning or the deep learning aspect of it is actually not it helps us accelerate the algorithm. So there are two parts to the algorithm. The first part of the algorithm is actually tracing out the bone, which a process that we call image segmentation. That is what we're actually using the deep learning for, the neural network for, because that actually is the most time consuming part, which we were previously doing manually by hand. And you can imagine if you have a stack of images and you need to sort of trace out this bone in every single slice manually, that could take like 45 minutes. So we're actually applying the neural network for that part. The second part of the algorithm is the biomechanical part, which takes a mechanical engineering technique called finite element analysis, and that is actually being applied to the information to the image, and from that we're actually extracting the bone mechanical properties. So it's actually sort of a couple. Those are the two major parts of the algorithm.
So are you getting bone density just from the CAT or MRI?
Yes. So when we're not we're computing more than bone density. That's one of the pieces of information that goes into the algorithm, but the algorithm incorporates the shape, the geometry, the structure of the bone, the shape of it, the density, and then it does a process that's basically virtual stress testing. That virtual stress testing is similar to what Toyota uses when they virtually crash their cars on the computer when they're testing the different car designs. We're applying that same mechanical engineering methodology to the images of the bones to simulate basically how much force it would take to break those bones.
And you touched on your competitors, but is this you're much more advanced than the other folks, or because they're doing something fundamentally different? You're doing something fundamentally different?
Yes. So our main advantage is that prior to the neural network step, so there's another step before that, which is a pre-processing step. We've developed a pre-processing step that can handle magnetic resonance images or CT images, and I think that is a huge advantage because then it could go either, basically allows physicians to go either way.
Great, thank you.
Mm-hmm.
Hey, yeah, so kind of going back to your real goal here and your vision, it seems to me that like outcomes for preventative medicine are really hard to quantify, right? So it's like you're gonna show someone that your images are better and that's gonna prevent them potentially from breaking a bone. So it's just like, how do you really quantify the impact that this have versus another one? Does that make sense?
Yeah, I get it. Yeah. So ultimately, what still will have to be done will be, there will have to be research studies done where the physicians, and this is what we're doing with the doctors at NYU now, is where you make the measurements using our software and also with the standard of care. You follow those patients for a couple of years and see what happens to them, and we see which sort of method at the baseline was able to better predict what was going to happen to those patients in the future. So you're hitting on a great point that absolutely there will still be research studies that need to be done to prove that this does have better diagnostic capabilities compared to the standard of care. So you're absolutely right.
Yeah, so I know this isn't the feedback section, but I would maybe just try to put that in because I was spending like so much of my time thinking about like outcomes. Like I get how your technology is different, but like how are the outcomes?
Yeah. That absolutely makes sense.
And, can you talk a little bit about, it looked like you guys have had a lot of resources and access to money to get to where you're at now. So I think you had mentioned something about, the NIH access, I think $12 million or so. What about, I'm trying to understand like timeline and, at what point is this ready for the market, and how does this, how do you get there? And does the money from the competition get you over the hurdle? I know you talked about it, using it for, a consultant or something like that, but I'm sure a consultant would do this for equity, in order to help advance those plans. So just help me understand, like, how you've gotten to today. You've, had a lot of capital to get there. It seems like you're so close. Like, does this get you over that next hurdle?
Yeah. So I think I understand. So the reason why we're doing this now is because we have the prototype software developed. We feel like we have enough preliminary evidence to show that it works, and we've sort of tested the market in terms of getting feedback from doctors and also patients that they want to get this test. The main restriction with the NIH money is that we cannot use it for commercial development. So we can't use it for the FDA application. We can't use it for anything related to the product, or even for filing the patent, things like that. It can only be used for purely scientific purposes. So that's really why we need to sort of form the company, and why we want to join the competition, because we feel like the prototype just needs to be converted into the commercial grade software, and we need to get that application in. But the reality is those things will cost, probably about $100K to do those things. And this would sort of be the ideal way to do that. And of course, like Glenn mentioned earlier, SBIR grants, STTR grants are something that we're also thinking about as well, because that could provide enough money for us to get over that hump. And then certainly with the research, our goal is to continue publishing studies in this era of evidence-based medicine, value-based care. We need to continue showing that there is value, that we're actually getting results that are going to change how patients are currently managed. I hope that's answered your question.
No, thank you.
We have 8 minutes left. Any other questions?
I guess I have sort of a market size question. I saw some numbers in your deck, and they just perplexed me a little bit. I think you showed a $10 billion market size in the US, and then a much bigger, I think it was $700 billion global market. Can you just, that might be the first time I've seen a global market that's 70 times as big as a US market. So I'm just curious how you arrived at those market sizing numbers.
Yeah, sure. So basically what we did is Medicare pays approximately $100 for sort of equivalent software type tests. And, we looked up estimates of the number of people in the US and then worldwide who are affected or potentially affected by bone loss, and then just multiplied by $100. So, I wish I could say that I did something more sophisticated than that, but it was pretty basic in terms of just looking at the number of people who have bone loss or affected by weakened bones, and multiplying it by like the current Medicare reimbursement. And that may not be the right way to do it. I'll be honest, that was just sort of the way I came up with.
Okay, thanks.
Other questions or feedback?
My feedback, and this I think is obvious, but I liked your angle on going to the medical device companies. There's you mentioned the deck, the drug companies, things like that. What I would encourage you to do is like get to market as soon as possible with the most, even if what you're doing isn't the end goal. And I think this is a learning into your space from technology startups, is like once you get in there and you start getting the feedback loop, and you get the real world and the setup in a hospital, and ensuring that they're okay sending images to a public cloud, or do you have to have it on premises, and what things you have to coordinate with, and learning about, hey, this CAT scan's 2 years older and has this soft, all that stuff. Because I'm pretty confident that the technology that you guys are doing is going to work and is going to be the future. Like, no one can convince me that machine learning isn't going to be really important in things like imaging bones and bone density. That's like, if you talk to a lot of smart people, that they would suggest that's the right approach, that'll be the future. And getting to market, getting in with the top places, getting the feedback loop, getting their feedback, talking, learning from then the drug companies will be coming to you, the medical device manufacturers will be coming to you. And I think you've got such a strong macro with aging population. My sister's disabled. She has juvenile rheumatoid arthritis, so I know all that stuff.
Yeah.
So I would encourage you. You guys have been at this for a long time. I saw on your deck you had an open position for a CEO. I would get someone who's incredibly commercial, who works with you guys and is maniacal about getting you guys into market. And even if it's like a second read or something that isn't that exciting, but gets you in there, get your software in there, get you doing it. You're going to learn so much from that, and then you're the front runner, and it's tough, for someone to come in and displace you from, radiology clinic where you're already there, even if, they've got something shiny or whatever. But similar to the prior presenters, I love what you're doing. I'm an investor in Chiron, which uses mammography to diagnose breast cancer. And I think, this is going to revolutionize all sorts of imaging, machine learning, and computer vision techniques. So love what you're up to. I think it's great, and applaud you guys for going after it.
Thank you.
Yeah, I think that's good advice. I would second that, and I think what I heard from the answer to my market size question too is you still don't know exactly how you're going to interface with the buyers, and so what John's suggesting is totally right, to give you more data and information about how the buyers are going to interact with your company.
Thank you.
Final comments from Jenny or Kim?
I assume you're also talking to Siemens and all those guys on the imaging side.
Yeah, absolutely. Yeah, I'm sending. I was the CT person at Siemens asked me to send him a couple slides earlier this week. So absolutely, yeah. That's the other angle. Yeah, I didn't mention that, but we're pursuing that. And GE has a big bone health business. So yes.
Yeah, I think getting in bed with them, so they may embed this stuff into their device, or it's a send to the cloud, and then you have a beautiful business model, because you're essentially getting the image. You have a per scan fee. I think $100 sounds expensive, but like, your margins on are so high, you've got a lot of room to fall, and still make money off of it. And then there's more and more that you can tick off as you develop the technology. So get to market, get in with these guys, get your technology in the scanners. And then the beauty at scale is, like, you'll have the biggest repository of scans, and hopefully you'll have some clinical data and outcomes on that stuff, and you can build a feedback loop. And then you've got the best technology in at the best centers, got the feedback loop going. You've got the high margin recurring business model. That's a formidable company.
Sounds great to me. Yeah, that's we'll get in there. Yeah, but we got to get in there. Yeah, we got to get in there. I appreciate that feedback.
Do you know anyone at NYU?
All right, Colin, Kim, Jenny, John, anything else? All right, I think we are good to go. Greg, thank you so much.